Ready? Okay. So this is module 7. I want to talk a little bit about postpartum hemorrhage from a patient's perspective. So I'm assuming that this is sort of the only module you're looking at, but postpartum hemorrhage, I guess I would start out by saying that it is normal to have some bleeding after every birth, but it really becomes concerning if it's greater than about a half a liter or a pint of bleeding after a vaginal delivery. The risks to mothers giving birth have decreased over time, but yet some risk still remains, and one of those risks is severe bleeding after giving birth. So who's at risk for bleeding with delivery? Unfortunately, it can happen without any risk factors, but we do know there's an association with the following. If there's an abnormality in where the placenta is located or how it attaches to the uterine wall, you can be at increased risk for hemorrhage around the time of delivery. As well, if you have twins or triplets, if you have high blood pressure in pregnancy, otherwise known as preeclampsia, if you have known problems with your blood clotting, or you have tumors on your uterus, otherwise known as fibroids, all these things can increase your chance of having increased bleeding after delivery. So what can you do if you have some of these risk factors? So the first thing is that you should see your obstetric care provider early and let them know if you have a history of bleeding with prior births. Let them know components of your medical history, such as difficulty clotting blood, details of prior deliveries if there were any issues, and any medical problems that you have, as well as medications, because this may help them determine the best path of care or the best location for you to deliver at. Now, after birth, it's standard for a medication called oxytocin to be administered. It's either given into your vein, diluted in a solution, or it can be injected into your shoulder, into your muscle. And the purpose of the medication is to help the uterus contract to reduce the chance of bleeding. During labor, as things progress, there are items that are associated with an increased risk of more blood loss at the time of delivery. Those are the need for cesarean delivery, having long augmented labors, larger babies, the need to have assistance with your delivery with forceps, having tears or injury at the time of delivery that need to be repaired, if you get infected in the uterus, or if some of the placenta remains behind rather than all of it uniformly delivering, all of these things can lead to an increased chance of significant bleeding. So if you yourself notice that you are having more bleeding after delivery, or you feel faint, you feel your heart rate increase, or you have new pain that's not associated with labor contractions, you should tell your healthcare provider immediately so that they can intervene and try to get you care to manage the blood loss. If you have a significant bleeding, it's typical that additional fluids and blood products may be given to you into your veins. Consequently, it's critical if you have questions about blood products or do not wish to receive blood products that you speak to your healthcare provider early on before you go into labor so they can plan appropriately and counsel you appropriately to the risks. Occasionally, if the blood loss does not stop with sort of standard medications and interventions, you may need to go to the operating room for surgical intervention or procedures that can be used to stop the bleeding. And in rare but extreme circumstances, your uterus may need to be removed to save your life if they cannot stop the bleeding from it. Thank you.